Today, on the occasion of World Rabies Day, I am here to discuss very few and major important points about rabies. The main clinical feature develops once the virus ascends from the wound site to the central nervous system, where it causes fatal inflammation of brain and spinal cord. So the symptoms are mainly neurological. So the symptoms are divided into two parts. That is furious part, where the patient develops fear of air, water, that is aerophobia and hydrophobia. Along with it, the patient may have hyperactivity. In the paralytic section, the patient will develop paralysis of upper and lower limbs. Now we will discuss about the vaccination part and preventive part. First, we will discuss about the animal vaccinations. So mainly the pets are cats and dogs. So in the cats and dogs above 3 months of age, we should vaccinate our pets, and mainly 2 doses of vaccine is recommended every 3 years. In humans, the preventive measures are mainly divided into two parts. The pre-exposure, that is before exposure to infected animals. In that cases, we generally vaccinate to the person whose profession might lead to rabies. That is, they handle cats and dogs and other animals. So in that cases, mainly people of veterinary and doctors are involved, and in that cases we give 2 doses of vaccine on 0 to and 7th day. Now the second one, that is post-exposure prophylaxis. It is the post-exposure prophylaxis itself is demonstrating that it should be taken, and the preventive measures which are taken after the bite. So in that cases, we have categorized the wound into 3 categories. So the first category, there is minor licking on the intact skin, or you may have fed the animal and they may have licked the tissues which are intact. So in that cases, just wash the wounds and do not, vaccination is generally not recommended. In the category 2 wounds, and there are nibbling of intact skin, there may be scratches, minor bruises. So there is no oozing of blood in the category 2. In that cases, we have to vaccinate properly to the patient, and the most important point is at least 15 minute wash of the wound through local detergent or any soap. You have to wash the wound for at least 15 minutes. In the third category, which is the most lethal form, and in that third category, there is major abrasions, bruises, and there is oozing of blood, and there can be wear and tear of the skin. In that cases, along with the vaccination, we have to inject local immunoglobulin at the site of infection, and we have to take proper preventive measures, and we have to wash the wound for at least 15 minutes, and we have to do the proper dressing with antibiotics and antiseptics, and we have to take care of wounds also. In the vaccination part, I have already told about the pre-exposure prophylaxis, where only 2 doses of vaccine was recommended on 0 and 7th day. In the post-exposure form, generally, if the patient is not previously vaccinated, we have to give at least 4 doses on the 0 day and the 3rd day and 7th day and 14th day. The 4 doses should be given to the patient in the category 2 and category 3 of wounds. If the patient is already vaccinated, if the patient has been already been vaccinated, then only 2 doses is recommended, that is 0 day and 3rd day. Hope I have made my points clear. So be aware and be safe and take care of yourself.